All right, I'm getting the word that we are exactly at 2 o'clock, so we are going to go ahead and commence. A couple of things that we remind you at each and every town hall is to please refrain from sharing any private health information in this very public forum. The reason why we wait to edit and then share it the following week is just because we occasionally have some folks who overshare. Veterans will have access to it on the YouTube page, and then of course other folks are joining virtually on Teams. Without further ado, I'm getting out of the way and turning it over to our fearless leader, Mr. Kai Menser.
Thanks, Chanel. No, you don't have to clap. That's all right. Like 3 people on my team are like, oh, let's clap. Good afternoon, everyone. My name is Kai Menser. I'm the director here in Atlanta, Army veteran. This is, in fact, where I get my health care. I live down the road in Roswell. So I come here for my needs when it works. And when it works is usually when it's timely, when it's easy, and when I'm sick enough to come here. Generally, I get sick when I'm on vacation somehow for one reason or another. So, you end up in an urgent clinic. I'm going to go over some high-level things with you guys because that's really where my focus is. It's obviously to get out and to spend some time with you. But I've got everyone that's standing is an expert to help support the specific needs you have. I started as a housekeeper in the VA, so if you've got any clinical questions, I'm not the one to answer those. I cannot answer those. I'm an extremely accountable leader, so if there's some folks that need to be held accountable, we can dig into that as a team. I've got a lot of folks that I surround myself with, and I make them do their jobs. And part of that is holding their employees accountable to the standards that we have set in the VA. So some real high-level information. So first of all, we were notified effective July 1st, so Tuesday, we have gone from 2 stars in quality and patient satisfaction to 3 stars. Yes, that's clappable. That's a big deal. And 3 stars is actually the average number of stars in the Atlanta area. So what that does is that's the CMS rating. It compares us to our peers in the community. 3 stars is not the end for me. I'm extremely competitive, and I think we need to be 5 stars. All right. The second thing on here is our Veterans Trust Score has continued to increase. And I've done enough of these town halls that there's people sitting in the room, and you're here for a reason, to speak up, to be heard, and we'll give you that opportunity to get addressed your issues, right? Because we're not perfect, right? Everyone in this room has served in one capacity or another, and you worked with people who weren't perfect, right? I worked with people who weren't, but we're here to improve those things for you guys. And what I'll tell you about our trust scores is almost 9 in 10 patients that come into the hospital say they trust us. Almost 9 in 10. Yeah, that's pretty high. All right, and then the last thing on here is our enrollment. You guys know this because you see it in your communities. You see people coming and going in the houses. You see more houses getting built. And most commonly, you see the roads getting more and more full out here in Atlanta. And that is because in the last year, we have grown by 10%. We're in the top 10 fastest growing VAs in the country by percent, and we're in the top 3 largest VAs in the nation by number of customers. All right. Our greatest growth is actually 15% in our women veterans. And so that leads me to some of the operational highlights. Staffing. So yesterday, or Wednesday actually, the Secretary of the VA did a hearing with senators, the Senate Veterans Affairs Committee, and one of the senators from Georgia, Senator Ossoff, asked the Secretary, when will Atlanta hire all of their vacancies? Yeah. He was referring to an OIG report that said we had 218 primary care vacancies. So we have, it changes every other day, but roughly 50 vacancies in our physicians, roughly 40 vacancies in our nurses, similar in our schedulers, in order to meet the growing demand of the 10% new veterans every month. So that equates to about 800 to 1,000 new patients a month for us. And you all have served, so you know it is impossible to build anything in the federal government, period, right? Let alone quickly, right? So we're trying to utilize the space that we have throughout the infrastructure, both here in this clinic and all the other 22 sites of care that we have, to really improve them. to see more me, more patients. Which leads me to a lot of our staff used to be remote. And since most of us last spoke, they became in-person providers, in-person mental health workers, in-person schedulers, in-person pharmacists, and that's causing some growth challenges. It's hard to find space for hundreds of staff who are at one time virtual. We still do have some virtual providers. We still have some mental health workers that work virtually. We still have teledermatology, teleradiology, a lot of the teleprograms where people are working from home. In fact, across the country, the radiologists kind of threw their arms up and said, look, if you make us come to the building where all we do is stare at a computer all day, we're going to go work somewhere else. And so we really had no decision but to keep them in a virtual capacity. We also pay much less than the community. We allow them to focus on the quality of care. And then the last one on here is our medical equipment. So we're not only investing in infrastructure, which I'll talk about in a minute, but in staffing. We've also invested significantly in our technology in our healthcare system. So there's 176 medical centers in the last year. We were 19th in the country in investing in technology to help provide better care for you all. Some of the high-level metrics that we've improved on. So if you come and stay with us, we're one of the most improved for pressure ulcers. So if you're staying in beds for a long period of time in our CLC, we're lower than the VHA average and 7th fastest rate of improvement among other medical centers our size. So we're doing really well with these qualitative metrics for our inpatients. Our primary care mental health provider rating is the 4th fastest rate of improvement among other facilities. We actually don't do very well with how you rate our providers. And we're really striving to do better with that. And part of it, as a veteran, I'm lucky that I get to experience it. When I walk in and talk to my primary care provider, like, how's it going? And I'm like, well, I'm here because I'm sick. Like, I talked to you yesterday. You know how it's going. But that's how they're trained, is to ask you how it's going. And so we're trying to retrain them to instead say, hey, I remember when I talked to you yesterday, here's what you said, right? But it's taking years of training to reverse that overnight for us. And so to me, it's like, well, you should know how I'm doing because I talked to you. So we're trying to fix that. So to me, it's nice that we're the 4th fastest rate of improvement in our provider rating. And then areas we need to improve. We need to improve on wait times. It takes like 46 days to get a primary care appointment as a new veteran, and I know that personally because I enrolled when people didn't know who I was. And so I got treated like everyone else gets treated, which is how I like it. It's like 100 and something days for most of our specialty clinics. And that's space. That's not having enough providers on board. That's having too many veterans. That's not having enough clinics. It's all these challenges that we just, as a federal government, struggle, hiring people. It just takes us so long. The second thing, our time to hire is more than 200 days. One of the things that really pleased me was when President Trump took office, he signed an executive order to improve the time to hire. I haven't seen it yet, right? I would love to get, how does that work? What can you do to help me? There's so many things that we have to do. You know this, in order to hire somebody that creates delays for us. And so I'd love to be able to do that much quicker than we already are, which is at 200 days. Back in 2009, when I joined the VA, it took me 2 weeks. 2 weeks from here's your job offer to you need to start before the end of the year. So we can definitely do that better. The next slide for me there. I want to, before I turn over to Dr. McCullough, I want to talk about Dr. McCullough, our acting chief of primary care, the growth that we're planning. So about 3 weeks ago, I was fortunate to be able to have the time to listen in on a call. Little unbeknownst to me, I was the only one on the call besides probably about 20 people from central office, and the call was intended for me. There's about $1.5 billion set aside to expand the infrastructure in Atlanta over the next decade. And what that looks like is, and we're still doing research, what it looks like is growth in the Gwinnett County. I know that's the opposite side of where we are, right? I know it depends on what time of day, 2 hours traffic from here. Yeah. And I know that's farther away, but it's going to help alleviate, I think, some of the other challenges that we have Just this week we had to shut down our ORs and cancel surgeries because we didn't have the infrastructure and the airflow appropriately working for our equipment. And instead of taking a risk of the patients getting an infection, we said we're going to have to stop this and stop the line. We shouldn't have to do that. We should have an infrastructure in Atlanta as one of the fastest growing and one of the largest in the country that works seamlessly for us. And our engineers don't have to jump through hoops every day to get things working for us. So one of those expansion opportunities is a very large clinic like this mirrored on the other side of town. One of the other things is CBOC, possibly in the North Roswell area, which would be nice for me. Another one is a clinic south of the airport that they're talking about building for us. And then two other things over in the Gwinnett area, a nursing home. One of our biggest challenges in Georgia, and I've only been here for a year, is our nursing home capacity is extremely limited in the community. And the best VAs in the country have big nursing homes. And so we need to have an expanded nursing home. We have the one that we have at Trinca Davis, but it doesn't have enough beds. And so we'll have patients sit in the hospital longer than they should because we don't have anywhere to send them. And the community won't accept them because they're at full capacity as well. So we're going to be expanding to a new nursing home and then an additional CBOC. So that'll put us somewhere around 28, 29, maybe 30 buildings in Atlanta. And we're already the largest with 23. So we're going to continue to grow that. So access will be improving before we do that by hiring providers. And I'll turn it over to Dr. McCullough, who's talking about some of her recruitment efforts and other things in primary care.
Good afternoon, everybody. I'm Dr. McCullough. Thank you so very much for being here. I am assisting a bit with the primary care at this time. And I just wanted to highlight a little bit of our access updates that we have in primary care. Thank you, Mr. Menser, for your updates, and that sort of highlights where we've been in the last several months. We've been challenged, certainly in primary care, with bringing on providers. But I do want you to know we are working and very committed to doing whatever we can through these challenging times in bringing in qualified providers for you. What that does is it helps, obviously, with our access, which we know we've been challenged with over a long period. So we are definitely actively recruiting and onboarding as we are able new folks to come in. We also have our telehealth partners, that's called CRH, and actually we have 3 of them here in this very building. And that has also helped us with bringing in brand new veterans. About 3,000 is our goal. And so we utilize these individuals not just here in this Cobb Multi-Specialty Clinic, but throughout our Atlanta VA system to support our providers that are already there to bring in our new patients and oftentimes to help us stop the waits that you've been having to get in to see somebody for your care. The other thing that we have been working very, very diligently on, and this is a new initiative that we've started certainly in the last several weeks, is working on certain providers' schedules so that we can open up new opportunities for you to see your provider. We know the wait times are long, and we've been trying feverishly to get more appointment slots available for you. So we are having a lot of work in the background. It's not as easy as it is sometimes to click a button. It does take several service lines and several individuals and time to do those things, but know those things are happening here and across many of the clinics throughout Atlanta. And even though the point is not here, the bullet point, most recently, and I was in a meeting, I believe it was just yesterday, we are working in select locations on some Saturday clinics. Right now, those are for some special populations. We are working with our women's veterans to be able to help them get in to get some of those preventative measures accomplished, along with helping those new women's veterans get in also. So we want you to know that even through some of the challenges that we've been facing throughout the last several months, primary care is certainly committed to working with you. If you have certainly recommendations, we want to hear them. That's why we are here. And we definitely appreciate your service. And I hope you can see where we are trying to serve you as best as we can in getting you in. Thank you.
Good afternoon, everyone. My name is Whitney Jackson, and I'm one of 2 Compact Act coordinators here at the Atlanta VA. I just want to tell you all what Compact Act does for you all. So what does Compact Act do? Compact Act allows the VA to expand access to suicide emergent care to eligible veterans enrolled with the VA healthcare system. Who is eligible for Compact Act? Veterans who have served in the armed forces, who have been there for more than 2 years in active duty, and have been discharged under conditions other than honorable or by court-martial. And what does Compact Act provide for veterans? It provides up to 30 days of inpatient care and up to 90 days of outpatient care for acute suicide emergent crisis. And who can report? There are 2 ways to report. You can report through the VA Emergency Care Reporting Portal or by calling 1-844-724-7842. And this can be done by the veteran themselves, a family member, a friend, or the community care facility that they are currently in. And how can veterans appeal the decision process made? There are 4 ways. They can appeal by contacting the local patient advocacy. They can contact VA billing inquiries. They can contact community care, or they can contact the 2 Compact Act coordinators, which would be myself, Whitney Jackson, and my colleague, Ms. Lamisha Eady. We can be reached at these numbers. Myself, I can be reached at 404-859-8559. Ms. Eady can be reached at 404-931-1381, and our supervisor, Ms. Shelley Lamb, can be reached as well. And we also have Compact Act brochures and frequently asked questions guides in the back with my supervisor, Ms. Lamb.
Okay, next up we'll hear from our chief engineer, which is Mr. Damian Mindley. And Mr. Mindley, just so you know, we've already had a question in the chat about Building 13. So before you take your seat or exit, let us know what the status is of Building 13. Thank you.
All right, thank you. The status of Building 13, we went in Building 13, did some renovation. So Building 13 is active and ready to be used. All right. Our first project is our pedestrian bridge project. This bridge has been down for a couple of years now due to several reasons. We are currently at the 35% design submission. On next week, we're going to have some estimates as to the different options or renderings that you'll see next. Next slide. This is the first rendering. It's a replacement in kind with a few improvements with some post-tension slats that will provide some deterrence. Next. This is just an interior view of that new bridge. Next slide, please. This is what this is the goal. Fully enclosed, fully conditioned bridge for your use. Like I said, now this is going to increase the budget significantly. We will know what the cost is next week, but this is what we feel like it'll improve the aesthetic appeal of the campus, and it's a major improvement from what we already have. So, next, please. And this is just an interior view of that fully enclosed bridge. Next. Our next project is to renovate 22,000 square feet of our 5th floor to make it a state-of-the-art behavioral health unit for our veterans. The current behavioral health unit was renovated or built in 2007, and obviously it's aged somewhat with time. So we're committed to improving the environment of care and providing a healing environment for our inpatient behavioral veterans. Next. As part of upgrading our high-tech, high-cost imaging equipment, we have several projects in different phases. This is one of few. This is our cath lab project, currently in design. Our current cath lab system is not operational, so we are focused on getting this one done as quickly as possible. The design completion for this cath lab upgrade is September 30th of this year. Next. This next project is the third Carestream radiofluoroscopy unit. We've installed 2 already this year. This third one will be completed at the end of July. Next. And to piggyback on what Mr. Mensah said regarding the community long-term care bed shortage, we are designing and building, we intend to build a 12-bed community living center short stay at our Trinca Davis campus in West Georgia. The design is complete, and we'll be submitting it for FY26 consideration at about $15 million. Next. And this just shows some of the interior view of that, of the pods. That ends my presentation. Those are just a few of the projects that we're doing. We have a full long list. Thank you.
Good afternoon. I'm Yolanda. I'm with Community Care, and I'm going to talk to you a little bit about community care self-scheduling. Yes. And self-scheduling will allow you to make your own appointment in the community if you have a community care consult. So one of the things that you need to know is that a community care requires a consult to be placed first. You can't just go into the community and schedule an appointment without you having a consult. A self-scheduling letter will be sent via a secure message to the veteran, or the veteran can opt in. It's very important that you know that you have to opt in to self-schedule. You can do this one or two ways. You can send us a message through secure messaging through My Healthy Vet, or you can talk to the team member that calls you about your options for community care. Once that's done, you will get a temporary authorization and packet to self-schedule with the community vendors. Thank you. And with that packet, you'll also get a list of all the community doctors in your area for you to schedule that appointment with. You will have 7 to 14 days to make that appointment. And after the 7 and 14 days, you will let us know if you're having any obstacles in the community in scheduling that appointment. And it's very important that once you schedule that appointment, that you contact us to give us that date and time so that we can send out a final authorization for you to see that provider in the community. And that's all I have.
Thank you, ma'am.
Thank you.
All right, next making their way to the podium is our CDCE chief, Miss Gwendolyn Ramos, and a lot of you know her, and she'll encourage you and your fellow veterans to join the troops to get some more drivers and volunteers and all of the things. No, you're not off the hook. You're not off the hook. I'm just warming them up for you, Miss Gwen.
All right. Hello, everyone. Thank you, Ms. Cook. As she said, I am Gwendolyn Ramos, in charge of the volunteers at the VA and surrounding clinics. If you are interested in volunteering, as you can see in the slide, we are interested in having you support the DAV drivers. We have vans. We are working on getting them up and running, but we need drivers to drive them to help support and bring veterans to their clinics. So if you are interested in driving our patients, please see me before you leave, and we'll give you some information. Next slide, please. And these are the areas and locations, so you don't have to be living in Decatur where we are located to drive a van. You can be in those locations that are listed on the slide, and we can accommodate you with a van to drive those patients. This helps them get to their appointments on time without interruptions or delays. Next slide. The qualified individuals will drive veterans with medical appointments in a disabled van from the surrounding area of the VA. Round trip, special rates, dates, times to be determined. No, I'm just kidding. It's all free. This is the criteria to become a volunteer driver. If you are interested, I know it sounds like a lot, it looks like a lot, but it is very important that you are qualified, tested, to be a driver. We want everyone to get here safely, so we do require that you get a physical. The doctor has to clear you to drive, current driver's license, and everything that you see here. We do provide the driving course test. You will have to do a defensive driving class to drive. Yeah, you drive out here every day, but we need to test that theory. Sorry. And thank you. That's all I have.
All right, it's always a pleasure, Ms. Ramos. Next up, we're going to hear from Mr. Adrian Urbina from our Veterans Benefits.
All right, how's everybody doing today? I want to say thank you all for coming. Thank you for your service. First of all, let me introduce myself. My name is Adrian Urbina. I'm one of the Assistant Service Center Managers for the Isaacson, Atlanta VA Regional Office. have to think about that because it's a new name for us. I'm one of the assistant service center managers. I'm going to provide you guys with just a little bit of what we got going on over there to try and help you guys with your benefits. So everybody knows about the new deputy secretary, Mr. Paul Lawrence. One of the things that is one of the most important things on his list is the backlog focus. I will go over that in a little bit, but that basically in a nutshell is to try and reduce the older claims. So that is a huge focus for him, and I'll tell you some of the ways that we're going to be doing that. So one of the things that we've got going on is Express 30 Pilot. So what that is that leverages some of the tools that we have to try and expedite the claims within 30 days. It was piloted at the, I forgot there's a screen here. Des Moines, New Orleans, Portland, Togus. So what that is we're trying to see anything between 1 and 4 contentions, right? Or 1 in 4 things that you're claiming, that does qualify for that. All right, next slide. So just a few of the accomplishments that we've done is we have done 2.3 million PAC Act submissions with a 74.4% grant rate. So it talks about the Express 30 pilot, right? So what that does is that takes the claims that are in the cloud, right, before they come to the regional office, and the goal is to decide those within 30 days. So the pilot, when they first started that, this data is a little bit outdated, but we were able to do 1,000 claims in 30 days. Go ahead, next one, please. All right, so this is kind of what I wanted to get to. This is a brand new thing for us. It's a backlog initiative. This is currently one of the hottest things on the Secretary's agenda, right? So I'm going to tell you a little bit about how we do that, how we handle that on a daily basis, right? So one of the things is not only how old is your claim, but how long has your VHA exam been pending with us? So that's 95 days. So one of the things that they instituted at all the regional offices across the country is mandatory overtime. I know everybody hears about the money and all this, but we still want all the veterans to get your claims timely, right? So beginning May 18th, they said all the claims processors, all the people that touch your claim, we're supposed to work overtime with the focus being the backlog claims. So what is a backlog claim, you say? That's a claim that's pending with us greater than 125 days. So 125 days or more, that is the backlog. Our goal is to try and significantly eliminate that by the end of the year. So one of the ways that the Atlanta Regional Office is doing that is every day and every month we have to report on how many backlog claims we've done that day. So the goal is to try and complete 75% of those each day that come down on that list, right? Because we want to make sure two things we want to do. We want to get you guys the right benefit amount and the right claim, okay? Next one, please. Okay, so this is just a little bit of data about the backlog claims. As we stated before, it's 125 days and above. So the goal is by December 2025 to see a significant reduction in those claims. So this is just a little bit of data as of June 20th. 767,881 claims. That's how many claims there was pending on a national level. That's everything. Okay, so of those claims, 193,229 were 125 days and above. That's 25.2% of the total inventory. If you ask me, that's way too much. So this is just average days that it takes us to complete those claims. That's from the time you guys submit the claim to the time you guys get the letter that it's completed is 102 days, okay? And then average days pending is 95. So how is the Atlanta office doing? How are we doing in relation to this? Okay, so our inventory stands at 7,936 claims. That's every type of claim. That's what we got at the Atlanta RO. Of those, 2,345 are backlog claims. Again, if you ask me, one is too many. Okay, so how are we doing? We are a little bit above the national average of 115 days to complete each claim. Okay, so another way that we're doing this can be called one of two ways: automated benefits delivery, or it's also called the automated decision support, right? So what that is, let me tell you guys what that is, right? These are some of the contentions and conditions that's part of that. So what it is we're trying to leverage technology so that we can go ahead and produce work faster, right? So what that is we are trying to leverage technology to do things for us. This is not an end-to-end solution. What do I mean by that? That means that your claim is still being processed by a human, by a person. We don't want a machine to do that. We still want the human touch. What this does is this gets the claim ready to be processed. It pulls the records, it does the service, it does all these things. It does all the administrative tasks, gets it to our people, they look at it, it's good to go, done. That way we don't have to spend as much time getting all the records, doing all the administrative stuff. We're trying to leverage technology to help us do your claims more accurately and faster. Next slide, please. That's it? Oh, wow, okay, that's it. Thank you guys very much for your time and attention.
Thank you. All right. Thank you to our presenters. We appreciate your time and your information and education. I do want to encourage the veterans who are standing in the rear. You are welcome to partake in an empty seat. We have plenty up here. Looks like at least 10 in the front and in the middle. So you are welcome to move about the cabin, as they would say if it were an airplane. And Mr. Menser, we are going to enter into the question and answer section. We ask that the folks who are here in person, please be mindful that we also have folks online. So I will do my best, along with my colleague Derek Smith, to monitor the chat. I believe we have upwards of 4 or 5 questions in the chat already. Let me finish. If I could have a few more seconds of your time. We do have staff members. Mr. Greg Kendall, our Public Affairs Officer, and Ms. Renee Francis Turner, our Congressional Liaison, will come around to you with the mic when it is your turn, and we will make sure that your question is answered. We have roughly about 30 to 40-ish minutes to get through your question, so please remember, refrain from sharing any personal health information or the last 4 of your social security number or any particular surgical procedures and things of that nature that would easily identify you on the internet. Sound good? All right, let's get going. I see that Ms. Francis Turner is next to a veteran whose hand I saw first, and she'll work with him on that.
Good afternoon to everyone, and thank you for the speakers and the representatives. I'm a Vietnam veteran. I have PTSD. Recently, over the health benefits of veterans, they cut back for psychologists and psychiatrists for PTSD to examine us or that program. I need PTSD counseling because that's what I have. Also, the gentleman was talking about claims and so forth. I've had a claim pending already for the last 6 months. I just counted it up. I need any assistance in that department, and thank you for any assistance in these programs.
Hey everyone, sorry, I was in the back of the room speaking to a patient actually that we're gonna have to get some information from because somebody sent him a screenshot of this town hall happening at the main hospital. Yeah, so I don't know where he got it from. I tried to look for it on the website. That's kind of what I was trying to dig into. He said there's about 30 people there. He's usually one of the folks that shows up early, so he left there to come here. So we're going to have to find out how that happened. And obviously it's not what I want. I want everybody here.
Well, it was previously scheduled last year, so I'll answer that. The communications team schedules all of the town halls the previous fiscal year. Last year, we scheduled them all at the Pete Wheeler Auditorium. Mr. Menser responded to a call from veterans that specifically asked to move the town hall to another clinic, hence why we are here. So originally, yes. At the end of 2024, it was posted to be here. About a month and a half ago, we posted it online on our website and on social media in all of the elevators and here at Cobb that it would be here in person as an answer to the call from the veterans in the audience. So we apologize for the inconvenience, but that is the reason why there would be an old date location.
Thanks, Shadell. So maybe we need to... Yeah, I still want to be able to be flexible when you as patients ask for stuff like this. And I was sharing, I don't have the capacity to come out on Saturdays and do this because I'm already doing other speaking engagements on Saturdays. And so last weekend I was in Dublin for 6 hours. And my kids are now saying, why do you keep driving, Dad? And so there's a limit that I have both as a veteran, but mostly as a parent. on what I can do. And so maybe we just need to plan a little bit better for the next year and rotating these around. And then when we get the recommendations, we'll just have to say no. Because I don't want 30 people to go to the wrong place and then we kind of not serve them. So in my one town hall, I was told to not hand over the mics. So I won't be giving you the mic. I will be holding on to it. The gentleman in the back, my team's telling me he's going to go first, and then I'll go to you, sir, from, unfortunately, Michigan State. Go ahead.
My question was about psychologists that we used to have that we'd be able to talk to virtually and so forth and go to the offices. I have PTSD. Those programs have been taken out completely. I've talked to them, and they said those programs was ended. I'm not able to do that anymore, and I have PTSD, and it is service connected. I was concerned about Mr. Adrian talking about the claims and so forth. I've had one pending for the last 6 months, and they did request a lot of paperwork, but now it's down to that the claim still is in process. Have I had any change of address or email or anything of that nature? No, I haven't, but I do need that. Thank you very much.
So PTSD clinic has not ended. We still do PTSD clinics, right? Yeah, my slides. So I just want to make that clear. We've not ended PTSD clinics. Maybe there's something specific that has stopped. So let's find out. I was going to read off the list of the folks in the back of the room, so I'm going to do it by memory as much as I can, even though I wrote it down. One of the things I like to do at a town hall is to tell you who's here, because I already told you I'm not the expert, right? So we've got somebody from primary care. You guys met Dr. McCullough. She was here. She's in the yellow shirt. She's in the back of the room there. She's actually, you don't have to turn around and get a crink in your neck. She's waving her hand. We've got somebody from My Healthy Vet. So if you've got any questions about how do I speak to my provider sooner, they're not responding, how can I get attention, how can I get enrolled appropriately, because it's changing. We've got somebody from our patient advocate's office who's been speaking with a patient back there. We've got somebody from Women's Health in the back of the room, 2 of them actually. We've got somebody from, here's the tables. Community care. 26% of our patients get care in the community in some way or another. We've got somebody from eligibility and enrollment. We've got somebody from Benny Travel. We have somebody from the VBA. You spoke with a gentleman up here. He shared with you. So if you've got specifics about your claim, they can help you with that. And I think that's all the ones I remembered are correct. Caregiver support, right here in a purple shirt. So if you've got some caregiver support questions. So the gentleman that asked this question about PTSD, I just lost him. You speak with the patient advocate folks, and they'll help you with that.
Hi. My question is about going to urgent care. Okay, I've gone several times to urgent care, and it's worked out great. They know the information. But my problem has been getting a prescription filled that's been written by a community care, urgent care place. They say, where do you want me to send the prescription? Okay, well, I don't know, CVS. I've gotten a lot of information, and it's all very confusing, but who can I go to get? I
got you. So the question is, when I get care in the community, where do I get my prescriptions filled? Right, whether it's urgent care or not. I will tell you that when I went to urgent care, I bring a second form with me. But that was in Mississippi, so I'm not sure what we do here in Atlanta. Yeah. Does anyone know the answer to that?
I shared the same issue with you, sir. I went and had a thing done, and I went to Kroger, no problem.
So did you have to bring a form with you?
So are you 100%? Maybe that might be why, if that's not the case.
Okay, so let us follow up. Let us follow up with you and get the specifics on that. And then what we'll do is we'll blitz it out and share it with as many veterans as we can, because that's usually what happens is one person has a question. The best person would be the patient advocate gentleman. He's bald. And he's got a blue polo with the glasses on right there. He's bald. I don't want to say he's bald out loud, but he is bald. Trying to just define who he is.
Let me stand up on this.
Oh, okay. We've got a row of mics. I'm sorry. Go ahead.
I'll be quick.
Thank you.
Kudos to this clinic, and the slides were great.
Thank you.
However, you didn't say anything about quality care. And the quality care,
I'll help you.
the quality care, not by the healthcare professionals, but by the ancillary staff.
Oh, yeah.
I had an incident at one of the clinics, and I was humiliated and degraded by an ancillary person. I reported it, and I have yet to hear from the director of that department.
Okay. I'll follow up with you. I need some specifics. I'm not proud of this number, but it is a number. No, it's not what you're thinking. 98. So I started in Atlanta on June 2nd last year, and there are 98 employees that have come across my desk that have been terminated. Some of them because of this. Okay? So we will follow up. Accountability will occur, right? Things like this come up, and I'm able to share the number, but we can't give specifics, obviously. That's not who we are. That's not what we do. But, yeah, it's a big number. So the same for you, sir. If you want to share, okay, we'll address it. I did want to alliterate on the quality, though. So 3 stars is all quality. Okay, it's 12 different metrics, from bedside care to we spoke, we communicated with you, to whether or not we're having conversations about your blood pressure medicine, to how well you're getting healthier or not. Those 12 metrics have about 100 metrics underneath them that we work on to improve that quality. But that's not really what you said, but it led me to. So we are improving on that quality. That's how we went from that 2 stars to that 3 stars. But we can work on our customer experience, and we will.
And I do understand that I am a healthcare professional, and I know all the rules and regulations for the private sector and for the DOD.
And it is DOD private sector now. The VA's adopted that same stuff. Yes.
Sir.
Thank you.
And I didn't get my labs done
Because of the, okay. I'm going to turn it over to my mic holders in the back of the room who have been.
And
telling me
after the 2 mic holders, we've got some questions that were posed in the chat quite early on in the meeting, so we'll get to those as well. I know it's a crowded room, and we have a crowded virtual room as well.
Okay. Hi. I wanted to say thank you from the bottom of my heart for getting therapists in for some of us to talk to. However, you have moved them from the Cobb Satellite Clinic to an area that, I'm sorry, when they have baseball games, okay, traffic's a bear. Traffic's a bear anyway. But when they have baseball games, and when I got, the first time I had to go out there, okay, it's off of Windy Hill Road, got in, evidently where you park and you come in, there are no signs anywhere to tell you what floor to go to or anything else, okay? And that just, if somebody hadn't been coming down the elevator and said, did you say something about the VA? And I said, yeah. She said, it's up on the 2nd floor. So I had nowhere to go. I mean, I had no idea where to go.
We
And
can
like
work
I
on
said-
that.
like
I've been
I
to the
said-
visit to the clinic. I think it's a beautiful clinic. It is in a nice space when there's not events going
Right,
on.
agreed, but it's just,
Yeah, I agree.
like I said, when there's baseball games going on, we're pretty much.
And we were going to get rid of that clinic, actually, and then the return to office executive order came out, and we needed to expand, and they were here, and that space was not being used, and so we brought them back to it to help support expanding access here. Yeah, the gentleman, the Marine that knows about the pharmacy stuff. It's we're robbing Peter to pay Paul in an environment where it's very difficult to find another Peter to pay for Paul. So it's just, we're doing the best we can. Appreciate your patience, your feedback on that. that will help us when we go back out to bid for a new place and what that looks like and where it's at. It's also why I'm so passionate about not growing within the city, because it's so difficult to get there. We got to grow external of what I've learned as the OTP area, right? Outside the, so yeah. Thanks.
Renee, you are next, I believe, and then we're going to go to one virtual, and we're going to get the Marine who has been waiting patiently.
Okay. Mr. Menton, first of all, I'd like to say I appreciate everything you've done and what you're still doing. Get rid of the people. There have been a lot of folks here that need to be gone, but I appreciate what you're doing. And there's one thing that we need to talk about is prosthetic. Prosthetic needs some peoples in there to help them out. There's 10 peoples in line at prosthetic, and I'm sitting there just waiting also. And there's one lady, one person over here, and there's one person in the back. So I goes to the lady over here and ask her why she can't help him because he's so tied up. She said, well, that's her job, just sit there and answer the phone. That don't make no sense. So something needs to be did about that.
Yeah, that doesn't make sense.
So whatever you can do to take care of that, and I appreciate it. And I'd like to applaud you for everything you're doing and still doing a hell of a job. Just keep on doing what you're doing.
Thank you. That's a big shift from the first time we met.
Amen. Amen.
When you got pretty upset with me, so.
All right, so in the virtual world, one of the questions that was posted a while ago says, why does it take so long to get a consult renewed for my community care doctors? My care with my orthopedic surgeon has been canceled because community care did not respond in a timely manner to renew my consult. And then they also asked what recruitment efforts are underway for primary care doctors, because when they check Indeed and USA Jobs, Atlanta VA has nothing posted.
Oof. It's a lot to unfold there. Okay, the one that I want to answer, I'll wait on. So there's nothing posted on USA Jobs, maybe at this moment. I'm assuming I'm at AD for Access, so I'll ask in a minute, so I'll prep you. There was a hiring freeze, and then that lasted about 2.5, 3 weeks. And then there was something that we didn't really speak about. All of our data systems and the ability to hire electronic, everything is now in a computer. They all stopped working. So what was working in December no longer worked in February. And we were unable to bring folks on because of this broken system for like 3 months. Yeah, I know. And it's nothing at the Atlanta VA. I don't own that system. I can't control it. The people that work for it don't work for me. So we really struggled with being able to bring people on. There was a lot of folks, like our brand new chief of dentistry, who's in the house. We were able to bring her on because she was already in the pipeline to come work for us. What we then discovered was that we were allowed to start hiring. So we started hiring again, but we had roughly 800 people in recruitment that we had to figure out, well, it's been a few months. What do we tell them? And how are we going to convince them to come work for us again? And then it was, well, you can only hire so many people because the RIF that has never been approved but has been talked about a lot. And so I don't want to bring on a Marine just to tomorrow tell them that they're fired because of the RIF. So we're trying to be very strategic with who can we bring on that we know will not be impacted. And the schedulers were one of the few folks that weren't approved right away for us to bring on, and that's community care. So that's one part of it. So we are recruiting in primary care. I don't know the number, or in community care. I don't have the number memorized for that one. It's been a few weeks, but we are recruiting for that. The other thing I want to talk about is how long it takes for us to schedule in community care. So about a year ago, it was like 70 days. Yeah. Now we're down to 42 days. Yeah. Navy, Elevate. I agree. That's not acceptable. You know, I'm afraid to say it, but it should take like 48 hours. Like, it shouldn't take, yeah, it should, yeah. It shouldn't, And as the nursing team, they have to re-review those consults every 14 days to see if there's anything wrong. You know, let me talk to the patients, and then you're getting it. So we are improving that. It's going to take more resources to improve that, except for in a couple areas where we just started enrolling in external provider scheduling. So it's the VA, it's an acronym, EPS. External provider scheduling lets you call me as a community care scheduler, or I call you and say, hey, I see a slot here for a dentist at the Cobb Clinic in the community. Pick whatever community provider. Does this work for you? Done. And you're scheduled. It doesn't require for us to call the provider in the community. Then the provider says, let me look at my grid and I'll get back to you. Then they call us back in 3 or 4 days. And then we say, well, let me call the patient and see if that still works. And the patient says, no, it doesn't work. Then we call the provider. That is the current process. And it's mandated by law. So I apologize that no one's ever taught you this, but it's the way that we are required to function. If we can get all the providers in the community, which Emory is signing up, we just need them to get over the hurdle and actually sign up, and that's a huge network. We've got some Wellstar, we've got some North, I always get them mixed up. Northside, yeah, we've got, I don't know about Tanner yet. Okay, we'll say that again, Piedmont? We'll have to check. And we've got hundreds. Actually, we're one of the highest users in the country. Okay, so we're trying to get better technologically as well. Let me turn over to our AD for Access to speak about anything I might have missed.
Good afternoon, everyone. My name is Kendra Lee. I'm the Associate Director for Access here at the Atlanta VA. So in addition to what Mr. Minter said, I do want to let you know we are hiring across the board. We have about 150 positions that we're hiring for within the VA. Now, that is as of last week, the week before. So it's going to take a minute to hit USA Jobs, but in the next couple of weeks, we should start seeing those postings out there so we can start those recruitments. In addition to what Mr. Minter mentioned about the process for community care, we are recommending that our veterans utilize secure messaging. That's one of the best ways to get quicker access to community care, to your providers, to get information, updates, so on and so forth. Although we are short-staffed, we make sure that we work diligently to review those secure messages. They're a little bit easier for our limited staff to respond to because you can get out a lot more emails typing quickly versus calling everyone. And so as much as we do want to improve, and we're working on improving our ability to reach out to you individually, it's sometimes quicker online. So that's a tool that we will be utilizing more to, one, provide you an opportunity to be more self-sufficient and get your information a little bit quicker. And then it allows us to better utilize the limited staff we have until we can get more people on board.
All right, we had the Marine who's with Mr. Kendall is actually next. And then we'll go to the gentleman in the red hat and then the lady up here in blue and one virtual question. I know, there's a lot of you to keep track of. We appreciate your patience.
He said,
Go ahead.
I'm a Marine, by the way.
So, sir, what I'm about to tell you is not a good story. You talk about trust. If you were to give me a question about my trust of this facility, I'd give it a 0.
Okay.
And I want to explain why. I need to talk to you about your solicitors that you have in this facility.
What's a solicitor?
A solicitor? It would be Citigroup, the one that you had, well, the one that was here. Okay, I don't appreciate the fact that we have people coming into our services in these VA facilities who are part of taking us down, sir. Any of these facilities, sorry, forgive me for being nervous, but this hurt me. It literally hurt me. Citigroup is here. I'm sorry. I hate that people say that I'm so intelligent, but it then comes with something that follows that I did wrong. But I am intelligent enough to know that when I walk past them and they are Citigroup and their CEO is giving money to Donald Trump's inauguration, and then their CEO is taking pictures with Ludnick, and then they are here, sir. And I'm sorry. Some of us don't like that man, and some of us still follow the Constitution. And to have any solicitor in this facility is wrong, especially those who want to shut this place down. And they hurt me to my heart. I was outside crying because of that. Forgive me. I got to tell you this one last thing. They stopped me from getting my damn therapy. They caused me to damn miss my session.
So this.
Who?
That's all right. The beauty of it is you're in a clinic full of providers.
Some visitors, I told them, I said, you guys support Donald Trump, and they laughed at me.
Well, here's what we can do for you. Right now, wait, let me, no, I don't need anything else from you. What I need is for you to take care of you right now. Yeah. And I don't feel like this is a good spot for you right now. Look, I'm going to politely push back. I do care. Because if I didn't care, I wouldn't be here. Thanks for your patience. Red Hat Marine.
Thank you. I'm representing a lot of guys, so I got a lot of questions. I'm in a group of men that mostly are combat veterans. I am not one, but they took me into their organization.
Shame on them.
And I'm sorry. But there's about 200 of us out in Paulding County. And we meet every week.
Okay.
And some of
Where do you
them
guys meet?
have a lot of hard problems.
Where do you meet?
We meet at Rodney's every Wednesday at 3 o'clock.
Is that something that my team can come and
Yes,
be
they
invited
can.
to?
You know what? That's one of the things I wanted to ask you about. Because in my post up in Illinois, we used to have VA people come to my
Yeah.
post. And these people would love to have somebody from your team come to Rodney's at 3 o'clock on a Wednesday afternoon.
You just give me maybe some of the questions, and we'll bring the experts with me, and I'll answer
Here's
them.
some of the things that I got. I got to
All right.
unlock my phone.
Let's do rapid fire.
And so one of the biggest things is, you've already touched a little bit on it, is callback time. Personally, I had to suffer for, I went through 5-6 weeks to get my approval to stay in therapy. And when I called and asked, why is there no approval for this? I kept getting told, tell them to send us the form. I stood there and watched her hit the submit button on her computer once, and next time she faxed it, and the next time she submitted it. I call back again and they say, we haven't gotten a form from them yet for you. So where do the forms go? That's one question I got. So then I got someone else in that when they go to the hospital, they're afraid to go to the hospital because they think they're going to get in an accident going in and out of the garage. And it's nasty. I got to tell you, it's nasty. I've done it, but I'm in motor transport, guys, so I can do it. But some of these guys don't like going to the hospital just for that reason, okay? They need to change something, and yeah, it's nasty. I like your opt-in to community care thing, but I'm wondering, and it took me, by the way, it took me 1.5 years to be able to get an appointment at a clinic since I moved down here. 1.5 years. You know what they kept telling me? We can't take anybody in. Why would a clinic tell me that?
When was that?
That was about 2 years ago over at Cobb West Clinic, the new one. And I know they didn't have many doctors. They still only got 3.
Yeah.
So there's a lot of veterans that don't understand why where we're at out in Paulding, why we got to drive 30 miles to a clinic.
Yeah.
If you want to put a clinic anywhere, we'd appreciate one out in Paulding somewhere. I bet it did.
Yeah, we'll put it on the list. So that's
So
3 questions.
those are just a few of the things, and there's some guys that
Give us your information, specifically the gentleman behind you with the red lanyard,
okay,
and we'll
well,
follow up and come out and visit.
that would be awesome. They would love it.
Yeah. Yeah.
All right.
Answer your questions more specific.
Sir, she was early on with her hand up.
Hi, Master Sergeant Newell, retired. My question is regarding community care and communications. I think the last time I had to go out into community care and do some imaging, They had to burn everything to a CD, and then I had to have a referral from my doc to take it to the main hospital for them to upload it to get the information back to my doc. Surely in today's age of advanced technology, there's a better way. And so I'd like to know what plan the VA has in place for better information sharing between the civilian providers and the VA providers.
That is a wonderful question. The VA is working diligently to get access to a lot of the information that civilians, doctors already have. We don't have that access right away, which is why we have a lot of the problems that we have. So when the gentleman was talking about faxing over forms and the forms not getting received, a lot of that is because we don't have the access to these outside facilities where, Piedmont can send it to this person, to Northside and back and forth because they already have MOUs and agreements in place. We don't already have that in place for a lot of these facilities. So it makes it a lot more difficult for us to obtain the information or to send the information. So that is something we are working on. Now, is it done right now? No. But we are working towards that. And so what we can do is for our next town hall, we can talk about what that timeline looks like and what changes are forthcoming. It is going to take some time. A lot of the things that you all are talking about are issues that are not new, but they do take time and support to get to a resolution. We have action plans in place for a lot of the concerns you have about access, improving appointments, scheduling, getting more doctors available, and making sure they're available when you're available, right? But to see that come out is gonna take a little bit more time. So I know for me, I have been here since November of last year, which is adding to your traffic, so I apologize in advance. But with that being said, my goal is to make sure that you have more access. As Mr. Minter mentioned earlier, we are extending our hours as best as possible, and that should be some more information coming out about that. We are hiring more providers across not just primary care, but also in specialty care areas. We're looking to see what we service you the best for and what's better in the community and making those processes easier. But again, that comes with talking with each other, working with each other, and we're collaborating. As you can see behind you, when we finish, you'll have a chance to talk to all these wonderful people, but we're here working to collaborate and to make those changes. It's just gonna take us a little bit of time. And so my commitment as the AD of Access is to be able to provide you more with timelines going forward. We will be having additional AD for Access veteran town halls. We're going to start those, I believe, next month, so hopefully something will be coming out soon, and that will be to talk specifically about community care, access to care, appointments, scheduling, and all those specific concerns, because that tends to be the bulk of the conversation for our veterans, and we want to be able to have better dialogue to provide you more updates and things of that nature. Additionally, we're working on developing a website where we can communicate to you all what information we know, provide you some steps so that you can be a little bit more proactive and provide better means of communication. One thing I do want to stress is if you do not have secure messaging, please, please, please get with our secure messaging team. They can show you how to get access to that, because that is one of the best ways to get off of the phones and actually get better responses. Again, part of the problem with our calls is if all of those 1,000 veterans that are calling in every day are reaching out, then it's hard to answer when you only have 12, 15, maybe 30 at the most on a good day of folks answering the calls. So it's not from lack of desire to want to do the things and provide the services. Oftentimes from our perspective is not having enough resources. And so until we're able to get to that point to have those resources, we're trying to find other ways to support our veterans. And right now, one of the best ways is through secure messaging. It is protected, so all of your information is protected. It's going directly to your providers, community care, or all the appropriate individuals. And we are monitoring them to make sure they're monitoring those areas. So that helps us to better help you. But we are working on these concerns. And I know someone on the chat asked about phone lines or telephone calls. So we are looking at our processes for answering the phone. It's not where we want it to be. And I think it's going to be a tiered approach. We're going to be looking at our operators. What information are they providing you? Is that as up to date as possible? Because as you notice, people change all the time, and it's kind of hard for them to get all the updated information. And so that's one of the areas where we're working on. Again, working to get our veterans off the lines as much as possible, more in secure messaging, so that frees it up for emergency situations so we can better answer the phone lines that way. And then making sure that we're getting you to an actual person, or at least to a method where we can collect your information and call you back when we have more time or more space. So thank you for your patience and your support as we're going through these changes. I know it's not always pretty, but please know that your leadership is here to support, and we do want to know what you have going on. We're trying to find better ways to get that information and then communicate with you all.
Real quick, I just want to let you all know that we did have a couple folks in the chat who said we need more cardiologists and we need more peer specialists to run groups for veterans so that they have folks to talk to as well. I know we had Mr. Kendall is next, and then there's the gentleman in the flag t-shirt.
Before we go to the questions, I just want to, folks are leaving, and I'm okay with that. Before everyone leaves, this is the first time we've been here at this clinic, and I want to ask what I would probably think is a dumb question. Should we continue to have a town hall here? Yeah, okay. Okay, all right. And then, real quick, in the back of the room, so we may not get to all your questions, right? You can see some of these are very complex. Yes, Navy, I'll come speak to you. Caregiver support, PACT Act, Benny Travel, My Healthy Vet, Patient Advocate, Women's Veterans Program, Primary Care, Community Care. I bet you Community Care knows the answer to your pharmacy question. Community Care, Eligibility Enrollment, and VBA are all in the back of the room, and you can speak to them with your specifics to get a direct answer from them too. Mr. Kendall.
Good afternoon. My name is Anita Willingham, and I am a participant in the Adaptive Sports Program. And I am here along with several of my teammates. And we are here today to ask that the gym on the first floor in the VA hospital be reopened, and to veterans as well as the Adaptive Sports Program.
I don't know.
So currently the gym is at the Atlanta VA on the first floor. Currently it is being utilized
Mr. Midley. There we go. I'm sorry to interrupt. Okay. They were just asking about the gym on the first floor in the VA, and I'm trying to think of where that is. He works out.
Yes. Yes, there was a very state-of-the-art gym. It's currently being used for pharmacy cash. That means that in case of an emergency, pharmacy has a stockpile of medicines that they have to distribute in emergent situations. So that's where that is right at the moment.
Okay. Yeah, so we're here to ask, can it be reopened so that we can use it?
I think we got to look into it. I mean, I don't know.
Yes, that has to be looked into. I can't make that decision.
Okay.
I don't know. Yeah, look, come on. Yeah.
And we're not able to do that successfully each time.
Yeah.
But if we had a place at the Atlanta VA, not only would it benefit the Adaptive Sports Program, but it would benefit all veterans. Yeah.
Yeah.
So this has been it's been going on for 3 years. And we have over 50 plus veterans that attend the National Veteran Golden Age Games, the wheelchair games, the winter and summer sports clinic.
I'll have to look into it.
Okay.
Here's I can't commit to anything. I mean, I think you guys know. One veteran's complaining because mental health is somewhere that's not easy to get to, so there's no space. Another veteran's complaining because there's not enough primary care providers because there's no space. Another veteran, at some point, I'll put it on the list, but at some point, I'm not saying no, but at a pharmacy cash, right, is, okay, I can't give you medicine anymore. That's what a pharmacy cash is for, right? And so we will look into it and work towards a goal of opening up another gym. But what I don't want you leaving here thinking, well, I told him. And then a year from now, you're like, how come I don't have a gym yet? Well, because we still like to give out medicine, and I don't have the space. But let me look into it and see what we can do. I don't know what was there. I've never seen it.
Is there somewhere, can I get a point of contact? come up with some alternatives if we cannot have yes.
Yeah, Damian Minley. I mean, he walks away. This is what you get. This is accountability. Look at the guy. He wants a gym too. Look at him. He wants a gym. He's like, where's my gym? All right.
Mr. Minzer,
No, wait, come on.
in the back.
Come on, right here. Come on.
Next.
Good afternoon, Marine Corps veteran. I just want to express that I second the emotion, the frustrations of a lot of you in here. I've too experienced a lot of these things. My thing, I just want to give a feedback on communication between departments within the VA. You know, because I can gripe all about community care, communications with community care, the VBA, you know, things like that. Just seems that nobody really talks to each other and transferring information, and there's no real centralized entity for guiding a veteran, especially younger veterans that are just getting out and going through this process. I too am part of a veteran support group, and we're also a men's group of prostate cancer survivors. So, you know, we do talk about these things. We try to advocate for each other and help each other out the best we can. But I just noticed that everybody has different stories and different ways of going about their, you know, getting their care, getting their benefits, things of that nature. And it just seems a lot of people are just misinformed and not informed. So one of the suggestions too, and I do appreciate all the presenters here and the great information. I hope everything goes well with all this, all these new improvements. But you know, I've been dealing with the VA system for over 20 years. Still, you know, still going through it, still trying to get my benefits, things like that, and I just keep on getting rejected. One of the things that I've been coming across is just a lack of you know, empathy for the veteran, for people that are trying to, you know, that especially in the front of the house at a lot of these facilities. And when you get screened for benefits and things like that, it just seems a lot of people are just kind of out of touch of what unique experiences we all have and what we've all been around. To the same, you know, to the extent that I've been disparaged as well. I've been discouraged. I've even in this facility, I've been treated, you know, pretty, you know, wrong as with the ancillary staff as well. And then, you know, just what I would just suggest, one, when hiring, please screen these people to understand what we are trying to accomplish all together. That we're not, you know, just, you know, all trying to take advantage of the system, you know, and things like that. But we all have our unique experiences and unique stories, and we're trying to work together just to, you know, to get what we, you know, what we deserve, the care that we deserve, because we did give to this country, and we did give to these same people the same level of care, you know. So that's one thing, and then two, just maybe consider some type of centralized call center or something, somebody that's getting into the VA system to know how to navigate through the system. And then just one last point is one thing that I did find out to be beneficial, which I had no idea of, was the best results that I've gotten as far as getting information through about how to navigate through all the channels of the VA has been, one, through a patient advocate, and two, through a social worker. Those two have been the, at least from my experience, the best way to learn how to navigate. Like I said, I've been trying to navigate the system for over 20 years now, and it's just now that I'm learning what, you know, how to go about things and what actually benefits are, or what the system actually offers you. So,
do you have a job?
I'm unemployed right now.
We're hiring.
But see,
we need patient advocates.
I would love to, and I would, and you know, I work, you know, I work towards helping people. I would love to, but right now my.
Do you guys want to jump up and down for the gym, but you want to jump up and down for a patient advocate? This right there we go.
I would do honestly. I would do both. I would definitely do both because I'm passionate about that. But just my level of trust with the VA at the moment is not there yet.
We'll fix it. We'll fix it. We're hiring. I know there's 5 patient advocates in recruitment. I appreciate the comments. I agree. As a younger veteran, it was difficult for me. My first time at a VA, I thought, these people are nuts. They don't do anything. I'm going to come here and fix it. I was at the Tucson VA, and I didn't fix anything. I was a nobody. And I left and went to the Florida VA and did start helping improve things. The social workers are key. If you've got some specifics on staff that maybe didn't treat you well, we do need to know about this, right? Because I can't keep hearing staff are mean to me, and I've never heard it before with specifics. Because you can't fire everybody, because then I'm gonna be having this town hall every day, right? About how we don't have anybody. There are people who do things. They come to work. I tell my staff, if you can't come to work and be 100%, don't come to work. Right? And they're like, man, the CEO is telling me not to come to work. Well, the problem is you treat one veteran badly, and they remember that for the rest of their life and tell 15 other veterans. That veteran doesn't care that your family has COVID, or that you just got kicked out of your house, or you had a flat tire to work and you're stressing all day long. Have a conversation with your supervisors. I tell my staff that constantly. Right? Come to work and be prepared. I'm going to turn it over to Renee Francis in the back of the room with our veteran that was spending about 4 hours with my patient advocate back there.
My name is Alicia McCord, and I had something to say about transportation. Yes. I'm appreciative for transportation when it works, which is seldom. I normally don't find out about whether or not I have a ride that transportation has allegedly arranged till the day before, in between the hours of 3 and 4. I can't get through.
It's breaking up a little bit. But here's what I'll do.
You only find out about transportation the day before.
It's gonna keep breaking up. I got two things for you, though. I know where you're going. One is my chief of HAS is in the back of the room over transportation. But two is accountability is occurring in that department. Here's the thing about accountability, though. You can't fire your way to success. And two people are always responsible when something breaks. The person who actually did it and their supervisor. Why did their supervisor let it break? Right? So she can follow up with Mr. Thank you.
Just so you know, we've got 10 minutes till our absolute hard stop. I know there's a lot of questions, so we do want to encourage you to speak to the SMEs in the room as well. If you have a question, we have folks here to help you with those things.
I got you. Go ahead, sir.
Some more detailed questions. Thank you very much for having this. It's gratifying that you moved up from 2 to 3. New watch, maybe a new commander. Give you all the kudos. We got your back.
Thank you.
The kicker is I work with a whole lot of veterans organizations throughout.
Could you put the mic a little closer, because everyone can't hear you? Thank you.
Can't hear this voice?
We got folks online too.
All right, so 2 to 3 voted on through the VA system. Am I clear that you said that it wasn't from the advocacy of these folks, but through the system?
No, 2 to 3 stars is actually compared to private sector and within the VA.
Voted on by the veterans?
No, it's based off quality scores.
Okay.
Some of it is perception of care, like one of the 12 metrics. So some of it is, but the majority of it is the quality of care.
2, we push very heavily for these clinics.
Yes.
Some of them have closed right after we set them up, the one in Roswell. This one was housed 7,000 veterans?
I think it's more.
Well, I notice you don't have any 7,000. That's what my numbers have been told that it's probably a third of that number. But here to say, I've got a lot of folks in the neighborhood around here that can't get in here, and they're being told places understaffed, so they can't get them in until the staffing goes up. So that's just
there could be some truth to that. Actually, there could be. I do think there's more than 7,000 here, because I get my care here, and there's at least 3 new providers that we just started that have roughly 3,000 patients, and that was in the last.
I'd heard
3
you
months.
lost 3 the last 3 months,
Could be.
private care. So the push from the community, and I'm just a soul soldier, right? The community is saying can't, don't, and won't. We're trying to fix that. We're trying to have brother help brother, sister help sister, to get into this clinic or to get into any nearby clinic for care. And then 2, follow that care up. Communication system is broken. There's no question of that. The reason being is when I hear of a problem, we test it. We have a whole group of veterans that just go, okay, let's figure this out. The online chat is a good thing. if the people will answer the online chat people, the primary care, the pharmaceuticals. Y'all don't get an answer. What we get back is, we're trying. So it's good of what we're doing. And moving to 3 stars, that's wonderful. But as a vote of the people, you already hear it, pushback. So anything that the community, and I will tell you, there's a place called We Care Fair. We put it on every year. We have about 5,000 people last year. Every veteran services nonprofit that we can get in the building at the Civic Center, we filled it up. The VA comes every year with all their folks to get you signed up. Don't forget the dates. There's one in Rome. We're going down to Fort Benning. The kicker is we are here to help the VA support you in any way. You got to let us in. You got to let us know.
I love it.
Those vet fairs are actually on the website. So for those who are joining virtually, we added that at the beginning of the Q&A. The We Care Vet Fair in Rome is August 19th. It is posted. The We Care Vet Fair here in Marietta is September 6th, and that is also posted on our website, as well as the one on October 21st in Marietta. So those are on our website events page.
Thanks, Chanel. But before I let you go, what I hear you say is positive things, right? Not negative stuff. And serendipity, Mr. Kendall back there, the gentleman that handed you the mic, he's actually our positive news story guru for the facility. So if you want to link up with him and share some positive messages, he can help tailor out that communication that he then sends out to the patients and to the employees. I think the biggest part of what we do is the perception of care. We could provide the best surgery on the planet, but if that provider, that nurse, that ancillary staff that we said today was mean to you, you could care less, right? And what I'm here to tell you is that we will not tolerate substandard care. We need you to help us talk about where it's broken, but also where it's working so we can go see where that is, copy that, duplicate it, and share it across the network. So if you want to get with Mr. Kendall, I think that'd be great. Thank you, sir. Gentlemen.
Okay, I use
Special Forces.
Yes.
Ooh.
I use secure messaging a good bit. It works real well. But the problem with secure messaging now is I'm reasonably technologically savvy. A lot of people my age and older are not. Logging in has changed about 4 times since last summer, and they say another change is coming in September. And it took me several weeks to get my login straightened out, and I'm fairly savvy when it comes to technology.
Yeah.
There needs to be an easier way to get people to use it.
I appreciate that feedback. I agree with that feedback. And we've got some experts in the room who has taught me on that because I'm also a patient, technically savvy, and was like, this is enough. The VA couldn't figure out what they wanted to do.
Well, that's evident.
Yeah. And so we're in the field at the end of the rope getting thrown around like crazy, trying to educate, teach, train, and advise. And you're right. It's great feedback, and I appreciate you sharing it so that when I am on these national calls, I can tell them, can we stop it already?
If you want to make it people to use it, it's got to be easier to use.
And we've got some great experts in the room. My Healthy Vet's been talked about a lot today. 2 things. My Healthy Vet's been talked about a lot. I'll be very clear. I love My Healthy Vet, but it's not the only way to communicate. Okay? I do. I think there will always be a telephone person to talk to. There will always be a telephone person to talk to, and we do have a phone book now. It does not give names. All right? I think it's evidence why we don't do that today. Okay? But we do have areas. In fact, we just created 20-some pieces of paper. They're called Save-A-Trips that give you specific numbers for each facility that you go to. There was one floating around up there that I saw this afternoon, so we can make sure to get those out. We do share those on social media.
They're on the website and social media.
We try and get them out, and they do change, which is one of our number one problems is you keep an extension from 20 years ago that doesn't work anymore, and then you come and complain to me. She hasn't yet done that, but she very well could. Then she complains to me that it doesn't work, and I'm like, well, what's the extension? That's a 20-year-old extension. So we're trying to merge technology. We're in that place right now. So we are working on a phone book. The other thing I want to talk about is resources. My job as the CEO is to get to a point where maybe a year from now, she can no longer, my whole leadership team is here. My chief of staff, my nurse exec, my associate directors, my chief, everybody's here right now listening in on this in the room. My goal is to get to a point where they no longer say, I can't do that because I don't have resources. Because that is BS, right? We shouldn't be saying, I need more resources to do the job. We need to be saying, well, this is what my resources are doing to get there, right? So, you know, it's true. We could use more resources, but it can't be the excuse every time you guys come and talk to us. Because at some point in time, we got to own it. Well, what are you doing about it? Right? So let me be very clear. Phones will always exist. You'll always be able to talk to somebody. Resources will always be a problem, but it won't always be our excuse. All right? And I appreciate the My Healthy Vet. Every day we look at My Healthy Vet, and what is the speed to responding? And we're supposed to be less than 2%? Less than 2%. Right now we're at 5.9%? 7.2%. Every morning we look and see all the My Healthy Vet messages for 180,000 patients. What's our response rate in 2 days? And are we meeting? So 6% of them are not meeting, 7.2% are not meeting the response in 2 days. So it just gives you a little bit of a reference. Our goal is less than 2% of those are not being responded to in less than 2 days. And so we're working on that aggressively to help, and we'll continue to work on the picture taking upload. Go ahead.
First of all, I'd like to thank everybody for the staff and everybody for coming out. I don't have a question. It's just more like a statement.
You know what? I just picked up on why you guys all have yellow shirts. I was just getting ready to say, man, everybody from Memphis come down here, and I just picked up. I'm sorry.
Yeah.
That'd have been better. What are you doing down here if you got a Memphis T-shirt on?
We just came back from the Golden Age games. But my statement is, I've been in the VA system since 1994, all around the country, different VAs. I lived different places. Atlanta seemed to me the best place I have ever gotten service. And I've been maybe 5 or 6 VAs around the country. And this is, to me, this is the best place I've ever been. I haven't had any of the problems that I'm seeing that some other people are having, and I'm actually like shocked.
I appreciate it.
But I appreciate you guys, and thank
Mr. Good News Story right next to you too. You can share some of this with him. He needs to be talking to. Yeah, I appreciate you sharing. Look, town halls aren't just to fix things. It's to hear from us, and it's to hear the positive things that are also working, so we can continue to do those. I appreciate it. And sorry I had to spend so much time in Memphis.
Thank you for that, sir. We're going to go ahead and end the MS Teams broadcast. We're at 3:30 now. We'd like to thank you for joining us today. For those SMEs that are going to stick around and answer questions, we appreciate it. And as always, we thank our veterans for your service and your attendance today. Thank you.